Yeah, I haven't even gone through it yet. I was just talking.
28-year-old Jennifer Benitez is a television producer.
Fort Lauderdale at 61, Miami.
She comes to work every day to a place surrounded with cameras, but being behind the camera is where she's most comfortable.
Yay, thank you.
Benitez, like many people, has always had a phobia of going to the dentist. Horrible experiences as a child have literally disabled her to go as an adult.
I don't know, getting teeth pulled out that didn't stop bleeding, stuff in my mouth, and you know, it's just like, it's never been a pleasant experience. Never, never, never.
And the years of neglect have taken a toll on her teeth.
I was like, forget this, I'll be okay. I'm like, I don't really need this, I'm fine. I don't feel pain 24/7. I can survive with it. Other people have. I didn't think I had that big of a problem or it was that big of an issue.
But Benitez was wrong. Her teeth and her health as a result were in pretty bad shape. Lucky for her, help was right around the corner.
Meet our dream team of doctors, Dr. Yolanda Centron, Dr. Nick Detour, Dr. Deborah Ferrer, and Dr. Michelle Matuk.
We're collecting records for her.
Our first step, meeting with Dr. Centron, and just getting Benitez to her office was tough enough.
There, I remember like I got like really nervous and panicked and I wanted to throw up. If I could have opened the car door and jumped out, I would have.
Most people that we see are horrified. They're paralyzed. They are emotionally destroyed. You know, it's just a fear that is so great that they'd rather die than come here. That's how big the fear is.
Thankfully, while examining Benitez, Dr. Centron combined an amazing bedside manner.
How you feeling? Being a model is not easy, huh?
No.
With soothing music, movies, and oral sedation to make Benitez feel comfortable. And it worked. We found out Benitez's major problems: an overgrown maxilla and undergrown mandible.
So she has no function. So I'm sure that the infection on the gums is infecting her heart and her lungs, and she's coughing like tremendously. Then the fact that her teeth don't match, then she's not able to chew properly.
Oh my God. If they would have told me the health aspects, maybe I would have done stuff sooner.
It's no wonder people don't like going to the dentist, especially with instruments like these hanging around. But before Jennifer Benitez's cosmetic repairs begin, a major cleaning has to come first.
And we're using a prosonic machine, which is very powerful in removing the tartar and the infection out.
We're just going to be putting on your braces.
With her gum disease gone, our patient is healthier already. Next, we visit with Dr. Number 2, Orthodontist Deborah Ferrer.
So you can see the teeth moving, so that would be about 6 months to a year, looking into the future, what the teeth are going to look like.
Dr. Ferrer is using a system called OrthoCAD to straighten Benitez's teeth and help repair her overbite.
I write a prescription of what I want, where I want the teeth to move, how I want the teeth to move, and they put the brackets on to the teeth, and then a computer simulates where they're going to end up.
And in about 1 hour, mission complete.
That's weird.
Open just a bit for?
Just 1 day later, Benitez goes back for more.
The trick to being afraid of the dentist is to go more often so you don't ever have to have anything major done. You don't ever have to have anything major done.
Benitez, on the other hand, waited 10 years to get a checkup, which is why her case is much more serious.
Hurting too, didn't they? Yeah. If you think of the jawbone as a block of wood or a piece of stone, because it's mostly mineral, then it's hard to move teeth through a piece of stone. What we're doing today is going to change the composition of the jawbone from more of a mineral-based bone to more of a water-based bone.
So instead of wearing braces for the average 24 months, a patient can be in and out of them in a quarter of the time.
Then we put in some donor graft material so that the teeth have some place to move into.
Not only is Dr. Detour performing the periodontally assisted osteogenic orthodontics procedure, but gum surgery too.
Eyelids look like they're getting a little droopy.
Both are painful, so Benitez is sedated.
In just a few months, Jen went through a lot, and thanks to our dream team of doctors in that time, her mouth got healthy, she had her wisdom teeth pulled, braces put on, gum surgery, and next is jaw surgery.
Because we think that her jaw is just generally out of place. It's not the right position for it. It's essentially lopsided and too far back.
Maxillofacial surgeon Dr. Michelle Matouk also points out her midline doesn't line up. We can see it here. This creates a crooked bite and smile.
In a healthy, young, professional girl, nobody should have that handicap. It's a social handicap.
Dr. Matouk performs a 7-hour surgery at North Broward Medical Center. The procedure, too graphic to show, works like this.
We open up the gum on top of the teeth, and we essentially just bring the jaw down.
The jaw is then placed in a new spot, making it more functional. And next,
we make a split along this way. We make a split in front and a split behind. And really what we're doing is we're slicing the jaw. We're slicing it so we can move it either forward or back. And in her situation, we're going to move it forward. We're going to put it in the right position that we want.
2 weeks later, and jaw surgery is still taking its toll. Jennifer Benitez is without a doubt still swollen, but she's almost done.
Recovery is long and hard or something.
It's been about 2 weeks since Jen got her braces off. In the meantime, she's had regular cleanings, she's had her teeth bleached, she even had temporary veneers put on. Well, today, she gets her real ones.
Veneers is one of the most rewarding and simple steps that somebody can do to kind of beautify their smile.
The teeth are filed down and sterilized thoroughly. Bonding glue is used to make sure the thin laminate porcelain shells from Microlab Dental stay put. Next, the teeth are hit with a UV light and the excess cement is cleaned off.
I don't think that she's going to ever need sedation, after this experience, because she's going to be stable and it's just maintenance. She's going to be all right.
From Dr. Centrone's office, Benitez's final stop is here to the Elite Group Salon in Fort Lauderdale, where creative director and stylist Henry Amador works his magic.
Since the look is changing so much, and she's obviously getting a little bit of a softer look now, to soften the hair as well.
Next, we're off to makeup.
Is this okay?
Yeah.
Okay.
A blow-dry, last-minute touch-ups, and finally, the surprising reveal.
Whoa. That's a big difference.
A big difference is right. We started with someone terrified of the dentist with threatening gum disease and major dental disfigurations. Jennifer Benitez used to take pictures like this. Well, today, she is a healthy 28-year-old woman with no reason to hide her smile.